Which of the following is an essential component of active listening in a medical setting? So active listening shows that you're not just listening to hear. So it's not just the patient speaking to you and you just hear what they're saying. You're listening in a way where you're really taking in what they're saying and you're actively participating in their care. Active is like a participation, and you're showing the patient that you're actively engaged and that you're empathetic to what's going on, and you're showing some feedback to show the patient that you're listening, you hear what they're saying, and that you understand what they're telling you. So you're participating, engaging in the conversation. So let's look at the choices to see which one matches that. So option A says maintaining eye contact and nodding periodically. And that's a good habit to have when you're speaking to the patient to show that you're listening. But we want to go beyond just listening or just hearing and looking at more of an active participation in this type of care. So option A is probably not the best choice here. So let's continue on. Option B says asking clarifying questions only when there are inconsistencies in the patient's story. And maybe because if you're asking questions and you're participating, so we'll consider option B, but there might be another choice here that works better. So option C here says summarizing key points at the end of the patient's explanation. So that would show that you're actively listening. So you might say after the patient talks to you, okay, I understand that you're here today at the clinic because you're having a sore throat and you want to be seen by the provider and get any sort of testing. So that shows that you're listening and you're participating in the care. So it's looking like C is a little more involved in this active listening approach as opposed to option B, you're just asking questions, but maybe option C shows you're participating actively in what the patient's telling you more so. So option C is looking good. Let's just look at option D here. Formulating a mental diagnosis while the patient is speaking. And if you might find with time that you might just, without thinking, you start doing that, start thinking about other things, but that wouldn't really be active listening because that shows that you're kind of, even without meaning to, maybe not fully paying attention to what's being said because you're thinking ahead at something else. So that wouldn't be active listening. So we can eliminate option D. And then that leaves us with option C, summarizing key points at the end of the explanation would be a component of active listening.